welcome you guys to this question and answer session today. Hopefully you've all had a chance to watch the COVID-19 response video that we put out last week. And we have some questions from you guys that Dr. Ernesto Domínguez is ready to answer in this Q&A session. So with that, I'm going to go ahead and turn it over to Dr. Ernesto Domínguez. He's the hospital director at the Wildlife Center of Virginia, and I'm sure you saw him featured in that video. So I'm going to mute myself and turn it over to him to go ahead and start responding to some of those questions for you guys.
Thank you, Maggie, and welcome everybody. Thank you for being here. I just want to start clarifying to everybody that today's session is just to clarify and answer questions about the COVID-19 video and not related to any other rehabilitation or wildlife rehabilitation questions. I will be just answering COVID-19 questions. So I will start with some questions that some of you guys sent beforehand. And the first question is, what updates can you provide about COVID-19 in wildlife, especially with regards to human-wildlife transmission? Which species can be affected by the disease? Are any known to be potentially pass it to human caretakers? So the last research has shown that COVID-19 can be transmitted right now to dogs, cats, ferrets, and potentially it can be transmitted to bats. And I'm saying potentially to bats, but no other wildlife has been shown that we can be transmitted from humans to wildlife. Although it can be transmitted to dogs, cats, and ferrets have been shown that are the only ones that can be showing clinical signs. And also you saw lately in the news that a tiger and some lions at the Bronx Zoo in New York were also affected by COVID-19. Now, what I want to clarify is that not because these animals have been positive to COVID-19, that means that this disease can be passed back from the animals to humans. That transmission hasn't been proven yet, but we have to be really careful when we are working with animals or with wildlife. Because so far we've known that humans have been transmitted to dogs, cats, ferrets, potentially to bats, and now with this transmission to bigger cats like lions or tigers, we have to be really careful when we're working with other mammals, because coronavirus are specific viruses that are transmitted to mammals, and we know that some other viruses or coronaviruses like MERS, SARS, and other coronaviruses out there are specific to mammals. Our bigger recommendation is that you guys, every time that you're working now with wildlife, you should be working with a cloth mask and wearing a cloth mask while you're working with mammals, just to prevent the transmission back and forward of this disease. The second question is, are the new cases of human-animal transmission indications that the virus is mutating further, or this is typical of zoonotic viruses? So coronavirus is a virus that can mutate for sure, and that's why we have seen new viruses. So you know that this coronavirus is called SARS-CoV-2. So it's called SARS because syndrome acute is of a specific acute respiratory syndrome or sudden acute respiratory syndrome, and it's called COVID of coronavirus disease, and it's called of 2019. Now, coronaviruses are a group of viruses that are RNA viruses that we know that RNA viruses can mutate really easily, the same as flu viruses. So of course, this is a new virus that was discovered, and it was discovered in humans. We don't know exactly if it came from wildlife or not. There is a lot of theories that it may have come from the pangolin or maybe from the bats, but it hasn't been proven. But we know that it probably came from wildlife and from the illegal wildlife trade. So that's why we think that it is a mutation of other coronaviruses that was out there in the wildlife. So because we don't know right now if this coronavirus can continue mutating or not, that's why we have to be really cautious about us protecting ourselves, but also protecting the wildlife in North America. And that's why you will probably start seeing some recommendations in some other states where wildlife agencies are highly recommending you guys are having PPE like cloth mask, gloves, and gowns where you're working, especially with a species like bats, so the bats don't get infected and these coronaviruses don't mutate or they affect wildlife, especially bats. The third question that we receive is how long should patients be quarantined that were transferred from rehabilitators that have tested positive for COVID-19? Are patients that have been exposed to COVID-19 considered releasable? So this question is, in the case that, let's say, a bat or a tiger or a lion or an opossum or a squirrel tested positive for COVID-19, for how long we have to quarantine those animals? That's something that we don't know yet. We know in humans, the disease takes 10 to 14 days for taking its course. For a healthy individual that doesn't have any comorbidities, so doesn't have to be hospitalized, you can be sent home, and in 10 to 14 days, you will clear the disease. We don't know this for dogs, we don't know it for cats, we don't know it for ferrets, and of course, we don't know it for wildlife. So we don't know yet for how long you will have to quarantine these animals. So therefore, we don't know when they will be ready to be released. So far, no wildlife animals in North America have been tested positive. The only zoo or exotic animals that have tested positive are these tigers in the Bronx Zoo in New York. And these animals, of course, are in captivity, so they're already isolated, but no wildlife so far has tested positive in North America. So we don't know for how long we have to quarantine these animals, for how long we have to keep them in captivity before release. And this is something that USGS, USDA, US Fish and Wildlife Services, and the CDC is still evaluating to know better and to have better answers for you guys. The fourth question is, can wildlife patients potentially act as a surface or as a fomite for disease transmission via their fur or feathers? If a rescuer is carrying the virus and touches an animal, can a rehabilitator be exposed when handling the animal? If so, what precautions can be taken? So yes, there is that potential. There's that potential that a rescuer or a private citizen coughs or sneezes or touches an animal, and some of those droplets go into the fur or into the feathers of that animal or into the cage or into the box of that animal, and then you're touching that surface or that fur or those feathers. And of course, when you're touching those, you can get contaminated. But if you're following the CDC recommendations that anytime you touch a surface, anytime you touch an animal, you wash your hands, you're wearing PPE, then you are reducing the chances of you getting infected by COVID-19. So the biggest recommendation there is follow the CDC guidelines. Always wash your hands, wear PPE, proper PPE, and don't touch your face, don't touch your nose, don't touch your eyes, don't touch your mouth. So if you're working with wildlife, I hope you guys are wearing proper PPE, and after touching wildlife, you're not touching your mouth, you're not touching your nose, you're not touching your eyes. Therefore, you should not be exposed to COVID-19. And if you're after touching any wildlife animal, you're washing your hands. Therefore, you're reducing the chances of getting exposed to COVID-19. Then another question more in terms for organizations and facility management was, what are the best PPE practices that we should be using in our facilities? Are there any additional measurements that bad rehabilitators should be taking? And I already talked a little bit about this, but even when there's no evidence that there is North American wildlife that has been tested positive for COVID-19, there is a potential risk for bats to being exposed to COVID-19. And this is because there's a really good publication out there of how susceptible are North American bats to coronaviruses. Therefore, if you're working with bats, you should be wearing PPE like gloves, a cloth mask, and then a gown. That is really important. So in general, if you're working with mammals, and especially with bats, you should be wearing a cloth mask, gloves, and a gown. That's the basic PPE that you should be working right now with bats. And that is just because of the risk of potential of you guys as humans transmitting the coronavirus to bats. Remember that we now know that a lot of people is not showing clinical signs and can be positive to COVID-19. So you might feel completely healthy and you might be a carrier of COVID-19. So even if you're feeling healthy, you don't have fever, you don't have cough, you don't have shortness of breath, you might be positive to COVID-19. Therefore, you should be taking all the precautions to not sharing COVID-19 to these animals. The second question is, are volunteers considered essential at smaller rehab centers? So that is a question that you guys should be deciding to answer. And is, do you think your volunteers are really essential to you guys or not? Our facility, the Wildlife Center of Virginia, is a big facility. We receive more than 3,000 patients per year, and we decided to cut completely 100% our volunteer program. We don't need our volunteers right now. And we did it because the more people we have in our facility, the more chances of our permanent staff to being exposed to COVID-19. So how essential is people? That is a determination that you have to put in the balance. How much is the risk? The more people you have in your facility, the more risk you have. We even at the Wildlife Center of Virginia divided our whole staff into 2 teams. So now half of the team is treating the animals. And even when this is more work and more burden to our staff, we take this determination because if somebody gets sick, we wouldn't want all the staff to get sick and then we have to shut down completely our operation or our facility. So that's why we decided that. We also have a lot of students that come through our facility at the Wildlife Center of Virginia, around 80 students per year, and we cut down our student program because of the COVID-19. So you have to really determine and put in a balance how much is the risk of receiving volunteers when those volunteers, you don't know what are their practices at home, if they are following the good practices of social distancing, when the family members of those volunteers are also following or not social distancing, those kind of things. So you really need to think about those risks and do a risk assessment to decide if it's worth it or not to have your volunteers in these times when it can be a high risk to have them in your facility. And then if you get sick, then maybe your facility will need to shut down and you will not be able to help any more wildlife. The third question is, what ideas can you offer for handling the increasing admission numbers with limited staff? And that's a really difficult question. I can tell you that our number of admissions has increased by 66%, right? In theory, people should be staying at home and not finding wildlife out there. But people is not staying at home. That's a reality. People is going now more out. They're finding wildlife in the trails by hiking, by going out into their yards, doing a lot of exercise, those kind of things. So at least at the Wildlife Center, the reality is that we have an increase about 66%. What can we recommend to you guys is get closer to your wildlife agencies in your states and try to find an exception where you can send some of those healthy orphans to your volunteers if your volunteers are trained to take care of those wildlife patients. And if you can send those healthy orphans, then your volunteers can keep helping you, but raising those healthy orphans at the house or home of those volunteers. Instead of your volunteer coming to your facility being a risk for you and for the rest of your staff at your facility, you can send those animals outside your facility to your volunteers so they can raise those healthy orphans. That will be my biggest recommendations. The other that sounds really hard and is really hard to make these decisions is sometimes you need to have cutoff weights. So really tiny animals that unfortunately you know that most of the times they don't make it, then it is a time to make sometimes those hard decisions where maybe squirrels are less than 30 grams, maybe bunnies are less than 50 grams. You may need to, unfortunately, in this time of crisis, when there's limited resources, limited money, to make the hard decision that you know that they have less chances to survive, to euthanize them on a mission. And finally, the last question for organization and facility management that we got was, how can we support fellow rehabilitators experiencing loss of income? So we all know that we are in recession right now. The United States has had the biggest unemployment rates on their history, and that is really difficult to manage right now. So how can we help each other? The best is to have a network between each other, support each other's, know what do we have in excess and share with other rehabbers, know those kind of things, try to look for more grants, really utilize our resources in a mindful way and be more creative, right? So for example, PPE, if we don't need to use all the PPE, how can we use it better? Do I need to use gloves all the time? Probably yes, but maybe I can wash my gloves and use them to the next patient. Once those gloves rip apart, then I can take them off from me. But then if they're not ripping apart, I can just wash them and use them to the next patient. Maybe if I didn't use to wash my syringes and reutilize my syringes, maybe now is the time to wash those syringes and reutilize the syringes. Maybe if I used to use the still water to use my formula, maybe it's the time now to test my tap water and say, well, my tap water is safe. I cannot use the still water anymore because I have limited resources. I should be using tap water for the formula. Those kind of little changes can save you a lot of money. The same of using more newspaper or less newspaper in the cages. Those kind of little changes make a huge difference in this time of crisis. But it is difficult. Everybody is going through this economic crisis. It's not just the little centers, also the big centers. Everybody is putting their resources now to help human health, and we have to understand that. Probably you guys also are trying to donate some resources and some of your resources at your centers for human health and for human hospitals instead of putting them for the wildlife patients. So everybody's going through this same crisis. So it's difficult for me just to give you one single tip or one single strategy, but there's multiple strategies that you can find. But the most important is keep united, keep building a network of rehabbers, and keep helping us between each others. So I mentioned PPEs, but I know veterinary clinics, one of the questions is that I mentioned PPEs, but they know that veterinary clinics and other animal industries are being requested to conserve when possible PPE for human healthcare. What do you recommend, or what do I recommend to not overuse these PPE? As I told you, for example, gloves, you can be washing your gloves, you can be using more glove resistant. Instead of using disposable masks, you can start using your cloth masks. So that is really important. With bats, should they be wearing N95 masks? No, N95 or respirators are considered N95 masks, are just considered to be right now exclusive for human health workers. So please don't waste this PPE on wildlife rehabilitation. Please assign those N95 masks for human health if you want, and if you have them, please donate them to the human hospitals. A cloth mask, and if you follow the CDC guidelines and their web page, they have a resource of how to make a really good cloth mask. Use a cloth mask, and that is more than enough to prevent you spraying the droplets, where the droplets of your sneeze or your cough is where the virus will be, and to stop that droplet to then being spreading the COVID-19 virus. So Dr. Falk said that cloth masks only reduce the risk of spread by 50%. That's her understanding. So again, the cloth masks reduce the big droplets, and in the big droplets is where the virus is. We have to remember that envelope viruses like coronaviruses that have these lipid membrane and big proteins are really big viruses that go in really big droplets. And these big droplets also fall really quick down. They cannot travel really far away. So with a cloth mask, following the CDC guidelines, actually they reduce the amount that they can get out of the cloth mask, and the few droplets, the really tiny ones that get out of the cloth mask, they drop within a feet. So their chances is you have to be really close to that wildlife patient to actually you will have to, in that moment, be talking to that animal or sniffing or coughing to that bat to be transmitting the coronavirus. And hopefully none of you are talking to your wildlife, because that is not a good practice. And hopefully you are not sniffing or coughing to your wildlife patients. So if you're wearing your cloth masks, you're preventing the spread of the coronavirus. Oh, Amanda. Amanda is asking me, is there concerns about mustelids getting virus given ferrets can? So the ferrets are from the mustelid family. And yes, we know that mustelids are more prone to coronaviruses. So mustelids like otters or minks or skunks, for example, we should have to be more concerned about, based on the fact that ferrets can get the disease and have more clinical signs. We should be more worried about them. But in general, with wildlife, because we don't know what is happening with them, in general, if we take general precautions of wearing PPE and especially a cloth mask, that will be the biggest recommendation. But yeah, that's a really good question, Amanda. Melinda is asking me, are there any facilities collecting bat serum for testing? So actually, we are not collecting serum or blood samples. What is being collected is feces. Feces is where we sample for animals for coronaviruses. That's where they are shedding most of the coronaviruses. For example, the tigers and everything. They took several samples, not just respiratory samples, but also gastrointestinal samples and fecal samples. So in bats, the best sample to be collected for most of the coronaviruses, it has been feces. So there's a couple of protocols, a couple of agencies, including USGS, the Pennsylvania Game Department and everything. They're already collecting feces in some caves and for a couple of wildlife rehab centers. Like, how concerned should we be about animals coming from a client or from a rescuer about them having coronavirus? So again, there's no proof that coronaviruses can be transmitted from an animal to a person. Now, an animal can be a fomite. That means that somebody can be coughing on that animal, sneezing on that animal, and then some droplets can be on their fur or their feathers. But if you follow the CDC guidelines that after touching any animal or any fomite, you wash your hands and you don't touch your eyes or your nose or your mouth, that you should not be doing after touching any animal, then you should be fine and you should not be infected by coronavirus. So they're asking me if the test is available for animals, if concern exists, if so, through what agency or lab. So currently, it was not decided that coronaviruses or COVID-19 was a reportable disease. Now there's a new guideline that we're working on, and I'm involved in that group nationwide with USDA. It's going to be now a reportable disease, and that should be tested through your Department of Agriculture, through your wildlife agency or your DNR, and that is sent to the National Veterinary Service Lab that is in New York. So Rebecca is asking me, is there recommendations to delay releases of wildlife to prevent the possible spread of disease to wildlife populations after having been in close contact with humans? Again, we don't know. We don't know, again, if wildlife is getting coronaviruses or not. There's no evidence yet. And we don't know for how long we have to quarantine these animals. So for example, in the case of the dogs and cats that have been getting it in Hong Kong and in Belgium, and in the case of the tigers at the Bronx Zoo in New York, we don't know for how long the disease stays on them. So we don't know for how long we have to keep them in captivity. Now, so far in North America, no wildlife has been positive to coronaviruses. So in the case somebody comes positive, then it will come the question of for how long we have to keep them in captivity. So far, the agencies in a couple of states have prohibited the rehabilitation of bats to prevent the spread of the disease. Some others have give exceptions to certain facilities to concentrate all the bats in those facilities, start testing, and then decide if somebody comes positive to continue testing until this animal doesn't shed the virus anymore. So that way we can know for how long we have to quarantine these animals. But so far, as I have told you, none of the North American wildlife has tested positive, and we don't know for how long we have to quarantine these animals if somebody comes positive. Oof, Amanda's asking me, is there a resource to find information on current state changes regarding bat rehab? Yes, each state on the web page of their own DNR or state wildlife agency. Probably you already got the letter of those wildlife agencies. I can tell you so far from the East Coast, Massachusetts already have a letter out for rehabbers, Pennsylvania also, Kentucky, I think also, Virginia, we're working on that. North Carolina is working on that. On the West Coast, California already got out one. On the Midwest, Iowa, Minnesota, Wisconsin, and the Dakotas already got out their own letters to regulate bat rehabilitation. And US Fish and Wildlife Services, I think, has been providing some information. And I can send to all of you the link, but USGS through the National Wildlife Services of USGS has made a big recommendation of how to wear PPE just because of the risk of bats being more susceptible to coronaviruses.